Cancer is one of the greatest challenges in modern medicine. Over the past decades, alongside surgery, chemotherapy, and radiotherapy, a new form of treatment has emerged: immunotherapy. What is immunotherapy? Oncological immunotherapy is a treatment that stimulates the patient's immune system to attack cancer cells. Unlike chemotherapy, it does not act directly on the tumor, but rather enhances or modifies the body's natural defenses to recognize and fight cancer. It can be effective in certain types of cancer, even advanced ones, but it doesn't work for everyone. Among the main strategies are immune checkpoint inhibitors, which unlock immune cells to act against the tumor; cell therapies, such as CAR T, which genetically modify the patient's T cells to make them more effective; therapeutic vaccines and monoclonal antibodies, which guide the immune system towards specific targets. These are complex treatments, often reserved for selected cases and administered in highly specialized centers. Benefits, limitations, and ongoing research. Immunotherapy can improve survival in certain cancers like melanoma, lung cancer, kidney cancer, and some lymphomas. But it may also cause immune-related side effects, such as inflammation in the intestines, thyroid, or lungs. Research is still ongoing to expand its effectiveness and better understand who can benefit from it. Immunotherapy is not a universal cure, but it represents a revolution in oncology. For reliable and accessible health content, subscribe to the Encyclopedia channel.